This is Optimal Health Daily, episode 2027. Flu in Older Adults, Symptoms, Complications, and More by Valencia with Healthline.com. And I'm Dr. Neil Malik, reading you some of the most popular health and fitness blogs out there, with permission from the websites, and always with a bit of my commentary at the end. And with that, let's get right to it as we optimize your life. Flu in Older Adults, Symptoms, Complications, and More by Valencia with Healthline.com. Overview. The flu, also known as influenza, is a seasonal virus that causes mild to severe symptoms. Some people recover in about a week, while others can be at risk for serious, life-threatening complications. The risk of complications increases if you're over the age of 65. Older adults tend to have a weaker immune system, which naturally occurs as we age. And when your immune system isn't strong, it becomes harder for the body to fight off a virus. When a flu infection worsens, it can progress to pneumonia and lead to hospitalization and sometimes death. If you're over the age of 65 or know someone that is, here's what you need to know about the flu, including symptoms, complications, and prevention. What are the symptoms of the flu? The onset of flu symptoms can happen quickly, with some people developing symptoms after exposure to the virus. If you start to feel sick, it's important that you know how to differentiate flu symptoms from common cold symptoms. Flu and cold symptoms can be similar, but cold symptoms are usually milder. Also, cold symptoms come on gradually. This is different with the flu. Not only is the onset of symptoms abrupt, but the flu also causes symptoms that might not occur with the common cold. Symptoms of the flu and common cold include runny nose, congestion, sore throat, and coughing. If you have the flu, additional symptoms may include fever, body aches, chills, fatigue, weakness, chest discomfort, and headache. If you're over the age of 65 and develop any of these flu symptoms, see a doctor right away to reduce the risk of complications. If you see a doctor within the first 48 hours of your first symptom, your doctor may prescribe an antiviral medication. When taken early, this medication can reduce the duration and severity of your illness. What are flu complications? Flu complications aren't as common in younger people and those with a healthy immune system, but up to about 85% of seasonal flu-related deaths occur in those who are 65 years or older. Additionally, up to about 70% of flu-related hospitalizations occur in the same age group. Some flu-related complications aren't as severe and may include a sinus infection or an ear infection. More serious complications can include bronchitis and pneumonia, which affect the lungs. Bronchitis occurs when inflammation develops in the lining of the bronchial tubes. These are the tubes that carry air to the lungs. Symptoms of bronchitis can include coughing up yellow, gray, or green mucus, fatigue, shortness of breath, fever, and chest pains. Bronchitis can lead to pneumonia, an infection that causes inflammation in the air sacs in one or both lungs. Pneumonia can cause chest pains, shortness of breath, and a severe cough. In older adults, pneumonia can also cause a lower than normal body temperature, confusion, and nausea and vomiting. Pneumonia is a serious complication. If left untreated, bacteria can get into the bloodstream and cause organ failure. This lung infection can lead to fluid accumulation in the lungs or a lung abscess. Other complications that may occur with the flu include inflammation of the heart, brain, and muscles. It can also lead to multi-organ failure. If you live with asthma or heart disease, the flu can worsen these chronic conditions. Don't ignore severe symptoms that develop while battling the flu. See a doctor immediately if you have shortness of breath, chest pain, dizziness, vomiting, or mental confusion. How to treat the flu. If you don't see a doctor within the first 48 hours of symptoms, antiviral treatment for the flu is less likely to shorten the duration or reduce the symptoms of the infection. However, antiviral treatment may still be given if you have a high risk for complications. There is no cure for the flu, so the virus must run its course. Symptoms do respond to over-the-counter cold and flu medications, though. You can take ibuprofen such as Advil or Motrin as directed for pain and a fever. It is important to get plenty of rest to strengthen your immune system and fight the virus. By taking care of yourself at home, you should feel better within 1 to 2 weeks. If you experience complications, your doctor may have to prescribe an antibiotic. This will treat a secondary infection, such as an ear infection, sinus infection, bronchitis, or pneumonia. If you have a severe cough, you may also need a prescription cough suppressant. How to prevent the flu. Prevention is key to avoid the flu and its complications. Everyone should consider getting an annual flu vaccination, especially if you're age 65 and older. If you fall in this age group, your doctor can give you a vaccination that's recommended for all age groups or one that's designed specifically for people age 65 and older. This includes the high-dose flu vaccine, which builds a stronger immune system response following the vaccination. There are different options that are designed to build a stronger immune system in response to vaccination, so ask your doctor about all of these options. Now, the flu vaccine is not 100% effective, but it can reduce the risk of flu by 40 to 60%. Flu season is between October and May in the United States, so you should plan to get a flu shot before the end of October. Remember, it takes about 2 weeks for the flu shot to be effective. In addition to an annual vaccination, there are other ways to protect yourself against the flu, like avoid crowded areas, wear a face mask and steer clear of sick people while in public, wash your hands regularly with warm, soapy water, or use antibacterial gel throughout the day. Don't touch your face, mouth, or nose with your hands unless they've been washed first. Boost your immune system by eating a healthy diet, exercising regularly, and reducing stress. Regularly disinfect high-touch surfaces in your home, like light switches, doorknobs, telephones, and toys. And visit a doctor if you develop flu symptoms. Takeaway. Everyone should take steps to protect themselves against the flu. Prevention is especially important if you're 65 years of age or older due to the risk of flu-related complications. Take steps to protect yourself and notify your doctor immediately if you develop any flu symptoms. You just listened to the post titled Flu in Older Adults, Symptoms, Complications, and More by Valencia Higuera with Healthline.com. You've been stewing about a health problem you have. You almost resort to texting your group chat to get your friends' opinions, though you know you're extremely unlikely to get any quality medical advice from them. But luckily, you can find it from a doctor on ZocDoc. ZocDoc is the only free app that lets you find and book doctors who are patient-reviewed, take your insurance, are available when you need them, and treat almost every condition under the sun. No more doctor roulette or searching the internet for questionable reviews. With ZocDoc, you have a trusted guide to connect you to your favorite doctor you haven't met yet. Millions of people use ZocDoc's free app to find and book a doctor in their neighborhood who is patient-reviewed and fits their needs and schedule just right. Go to ZocDoc.com/OHD and download the ZocDoc app for free. Then, find and book a top-rated doctor today. Many are available within 24 hours. That's ZocDoc.com/OHD. ZocDoc.com/OHD. Dr. Neal here for my commentary. Now, what about taking vitamin C, vitamin D, or zinc to prevent or get over the flu more quickly? These nutrients are important for keeping the immune system working at its best. Most studies have found that supplementing with these would only be helpful for those that are actually deficient in these nutrients. Now, in older adults, it is possible that a slight deficiency in vitamin C, D, and the mineral zinc exists. This is because as we age, we just tend to consume less food in general. This would definitely affect vitamin C and zinc consumption. Plus, as we age, we're less likely to be active outdoors, which would help the body create vitamin D. Now, am I saying every older adult should be supplementing with these nutrients? No, but it's definitely worth a discussion with your healthcare provider. All right, that'll do it for today. Don't forget, I'll be back here tomorrow for our usual Friday Q&A, so definitely stay tuned for that, where your optimal life awaits.